Tensor fascia lata and iliotibial band. Notice that in addition to the tensor fascia lata, the gluteus maximus can put strain upon the iliotibial band. The next specific type of stroke I'd like to talk about is a stroke that separates muscle compartments. We, in some ways, could say that this is similar to the last stroke we did, which is separating muscle compartments from deeper layers where they've been glued. But very often, muscles that are supposed to be running alongside each other will then get glued to each other so that there isn't a real sharp demarcation. One of the areas that this is most evident in is with the IT band, or the fascia lata, and it can get glued to both the quadriceps group here or to the hamstrings group here. And what you'll often notice when you feel with people is that it can slide one way much easier than another. Dina's slides much more easy toward the hamstring than it does away from the hamstring. So she's a little bit bound right along the hamstring here. And this might cause a lot of torsion and tension on her knee. So all I'm going to do is try to differentiate these muscles from each other so that they can slide in different directions. Again, we will go in much more detail in the tape talking about how to work on the knee for specific techniques here. So this is one that I often use just my fingers. And what I'll do is I'll just get on the top border of the IT band here, and here's the quadriceps, here's vastus lateralis here, and I'll just slide right down there. Anytime I feel some adhesions, some tension there, I'm just going to sink in, possibly roll this quadriceps away, see if maybe there's too much tension. If I roll it toward it so that I can get a little bit better grip on here and soften this and work my way down very, very slowly. This is going to be work that requires very, very patient work because it's going to be very tender. Since Dina is more bound toward her hamstrings, I'll probably have better luck by grabbing this IT band, pulling it away, and then trying to find the hamstring area that is bound to it. So I'm rotating her leg internally, finding areas here with the hamstring, and there's some fibrous area right here, and right in there. And I'm just going to wait for that tissue to melt. Notice how slowly I'm working. I could use my knuckles here, because I'm pretty used to doing this, but you're not going to get quite as sharp a hold there. So it's up to you how you feel with the strength of your fingers to do that. If your fingers aren't quite strong enough, then use your knuckles. You'll also find it's much easier to have your hand resting on the table when you do this, rather than trying to lift it up. The gastrocnemius muscles. Notice that these are actually two different muscles with different attachment points. Depending upon the strain placed on the lower leg, one muscle may be considerably tighter than the other and create torsional strain upon the Achilles tendon. Hamstring muscles. Many beginning massage classes talk about relaxing the hamstrings as if they were just one muscle. Notice the wide variation in angle and how tightness on either the lateral or medial hamstrings can place strain upon the knee. On the gastroc area, you could even differentiate the lateral head from the medial head. There's a nice septum that runs up the back of the leg here, with the gastroc basically being a two-headed muscle. So sometimes, if one side's much tighter than the other and it's pulling in an inordinate angle or something like that with too much stress, all you need to do is just separate these muscles. And you can almost see with Dina's hamstrings here, we've talked about how they're sort of bound to the IT band here. You can almost see her lateral hamstring being pulled over toward the IT band. So not only is it pulling the IT band back, but this hamstring is pulled too far laterally so that it's not pulling straight on the leg here. So all I need to do on this one, I think I'm going to shorten the hamstrings a little bit so I can sink in. So I just lift the leg a little bit, almost like we did with the anchor and stretch, but I'm not going to be actually moving down here too much. I can a little bit, but I'm just going to work my way up all the way along this lateral hamstring here. Anytime I feel any fibrousness, I may want to shorten it a little bit more to sink in here. Let's discuss the importance of body positioning in your strategies for working on your clients. I think in early massage training, we often look at a massage as a chess game with two moves. The client is either beginning on their stomach or beginning on their back, and you have one move to turn them over. As we get into problem solving, it becomes very important to have an understanding of anatomy and kinesiology so that you can place joints in such a position to make a stretch on the muscle you're working on. Let's look at the biceps and the elbow as an example of this. If you have a client coming in that's been lifting weights for 15 years and this is about as straight as his arm can get, then you can do all the work you can in a neutral position for him, which would be about like this, of softening the muscle, of working with adhesions, but in all probability, when he stands up and gets off the table, his arm is still going to be bent at about this angle because you've not given any signal to this muscle to lengthen. So the importance of understanding how to move bodies can help your work immeasurably in the results you'll have, because the main issue that we have talked about in this series has been the importance of stretching muscles rather than just squeezing muscles. So do take the time to cultivate these skills of learning how to move bodies and have an understanding of kinesiology and anatomy so that you can work with the neurological component of muscles rather than just squeezing and softening muscles. You can give very, very important cues to your clients to have longer, more supple, and more freer movement if you start stretching their muscles when you're working on them. The rhomboid muscles. The rotation of the scapula will dictate whether you are stretching the lower or the upper fibers of the rhomboids. A clockwise rotation can stretch the upper fibers, while a counterclockwise rotation can stretch the lower fibers. We've talked earlier about how the rhomboids attach to the spine and then come along the medial border of the scapula here. If we look at the upper fibers versus the lower fibers, we notice that when the scapula is in a neutral position, the lower fibers are longer here. If I want to work on the upper fibers, I want to bring this scapula as far rotated this direction as possible so that these muscles can lengthen and redefine themselves. If I call my client into doing some active work along with this, all I need to do is facilitate that lengthening and call for her to reach down with her arm, and that's going to rotate this scapula. So somebody that's very, very tight in the upper scapula, you would continue to work on them this way. They may have a lot of length here, and you don't need to redefine that. However, somebody that's got their scapula pulled this way with very short fibers, you're going to want to stretch those. And working in this position is not going to do that because the scapula is rotated in this direction. So all you would need to do would be to take the arm up, and that rotates the scapula this way so that you can then work on those lower fibers and lengthen those. If you wanted to reset those neurological factors that are determining muscle length, you might even have your client reach up above their head while you're working. It may seem strange to be asking for movement from your client, but as you're moving into deep tissue work, people expect this, and you'll find that its increased effectiveness will more than make up for the upset that you may be thinking you're giving this person when you think they're totally relaxed. Along the same lines, a lot of people come in with their shoulders up toward their ears. So all you need to do is be sure that you've got this shoulder down as far as you can. If you want to call for active movements, that's great, but you just be sure that you put a stretch on this muscle. You don't have to call for active movement, but that is the way to make it the most effective. The main thing is to consider, how do you want this body placed so that that muscle is on a maximum stretch?